Greetings, everyone. Welcome to today's webinar, Using GPS Data to Understand the Relationship Between Mobility Behavior and Well-Being, a unique look at how location determination is linked to mental health. Today's webinar is being presented by Dr. Gabriella M. Harari, Assistant Professor at Stanford University, where she directs the Media and Personality Lab. Her research examines how personality is expressed in physical and digital contexts in everyday life. In particular, she studies what digital technologies, such as smartphones and social media, reveal about personality and how digital technologies are changing personality. Her work has been published in academic journals and has been supported by the National Science Foundation, National Institute of Health, and Stanford's Human-Centered AI Seed Grant Awards. We appreciate Dr. Harari for presenting today's webinar. Following her presentation, we'll take questions. To ask a question, you can click on the Q&A box in your viewer. Now we turn the time over to Dr. Harari.
Thank you. Thank you so much, Rick, for the introduction, and thank you for having me. I'm really honored and humbled to be speaking to the Institute of Navigation community. I think as you'll see in my talk, I am not someone who develops technology for GPS, but I definitely try to use GPS data to understand things about human behavior and psychological experience that we would not be able to understand otherwise. So what I'll be talking about today is some of the work that we've done using GPS data to understand specifically the relationship between how people move about through their physical environments, so their mobility behavior, and how that relates to their well-being. So I wanted to, let's see if my slides will go. Yeah. So I wanted to just start off by just briefly introducing you to me, like who I am and my work and why I'm here. So I'm a personality psychologist by training, and I study, my group and I, the Stanford Media and Personality Lab, we study individual differences in how people think, feel, and behave. And we try to do this at the intersection of psychology and media studies. So we're looking at how, the everyday kinds of digital media that we use, our laptops, all of our devices, our laptops, our smartphones, our social media platforms, how these technologies reveal information about who we are in terms of our personalities, and also how our use of these technologies might be changing who we are in terms of our thoughts, feelings, and behaviors. So the work that I'm talking about here today is a line of work, a line of studies. We'll be focusing on one study in particular, but it's essentially a line of work that is really about what smartphones in particular as a device reveal about human behavior and what they can tell us about people's psychological experiences. So we've run, in our group, we've run several studies that essentially use data that can be collected from a smartphone to try to obtain objective assessments of human behavior. And then we link those to people's self-reported experiences. And so today we'll be focusing on this work with GPS data and well-being. And here I just wanted to kind of orient to this methodological approach. So up here on the slide, you can just see, this is an illustration of smartphone sensing or mobile sensing, as it's often referred to in the computer sciences and engineering sciences as well. Up here on the slide is just a visualization of how we as social scientists, and myself and our group as a psychology and communication team, how we think about the data that you can obtain from someone's phone. So on the one hand, so the way that this methodology generally works, and this is what the study today will be focused on, is essentially we have participants, research participants, who participate in our studies. And if they do so, they will download a smartphone sensing app to their phone, which then allows the participant to actively log data. So we ask them questions as they go about their day. They get notifications from the app that ask how they're feeling, where they're spending time, et cetera. So we get this kind of subjective report, as we normally would with a psychological study where we ask people how they're doing. But then the really novel component of this methodology for us as social scientists is that we're able to collect passively sensor data from the device itself. And here on the slide, you just have some examples of kind of the most standard common commonly accessed types of smartphone sensing data that are typically collected in this type of work. So you have things like call and text logs, Bluetooth, microphone, et cetera. You can see GPS is also here on the list. And at the bottom here, I've just noted some of the papers. We have the Lane et al. Paper is a kind of a survey of mobile phone sensing that was published in more a computer science outlet that first kind of outlined and provided a big picture overview of this methodology. And then in 2016, we published a paper, Perspectives on Psych Science kind of paper, bringing this methodology from computer science to psychologists and trying to argue for, using this type of passively sensed information to make more accurate and reliable inferences about human behavior and what that could tell us about people's psychological experience. So to give you a more concrete sense of what I mean by this, here on the slide now, you just have the same list of sensors that we had on the previous slide with the smartphone. And now those sensors are also have our arrows that are pointing to the different types of inferences that are made then about human behavior. So if you look at the highlighted example here, these are the most relevant for today. You have things like locations that a person visits or the amount of distance that a person travels. And then those types of inferences are made from the GPS data that is collected. And you can see other examples here on the slide. These are other common types of human behavior that are typically inferred from the various sensor data that's presented here. And we have I've just listed a review paper here that lists kind of the many different kinds of behavioral inferences that are being generated from the types of smartphone data that our devices naturally generate. And they typically can be characterized as being about social interactions and social behavior, physical activity and mobility behavior, which typically are from accelerometer and GPS data. And then there's a kind of a miscellaneous third category of daily activities, where sometimes folks typically more in the computer and engineering sciences will be trying to develop algorithms that can infer more complex human behaviors. So this is an introduction and an orientation to what we're talking about today, and essentially how our group is using GPS data in an applied setting here to understand well-being. So the paper that I'll be presenting the findings from and discussing today is a paper about individual mobility behaviors and subjective well-being that I worked on with several colleagues who are here listed on the slide. Sandrine Mueller and Heinrich Peters were the two first authors who were both at Columbia Business School at the time of publication. Sandrine Mueller is now at Google. Sandra Matz is another colleague of ours who is at the Columbia Business School who worked on this as well. And Wei-Chen Wang was a computer science PhD student at Dartmouth who assisted us with a lot of the more technical components of the mobile app setup, so the actual development and back-end maintenance of the mobile application that we use to collect data. And Wei Chen was also the primary person who was analyzing and pre-processing the GPS data to extract the features that we were interested in. So I've just listed them here, and I want to acknowledge them. And the paper that I'll be presenting on today is also listed here at the bottom of the slide. This was published in 2020, so if you're interested in more details, you can check it out. I won't be able to obviously talk about everything that was included, but that is generally where we're at. So, okay, so I just wanted to start by talking about subjective well-being and how we're conceptualizing well-being in this work. So, subjective well-being is a term that can be defined in many different ways, depending on who you ask. And of course, when you ask psychologists, there are many opinions about this. What we focused on in this project is really cognitive and affective levels of well-being. And so what that refers to is essentially, the affective kind of aspect of well-being refers to things like your positive and negative affect or your positive and negative moods. And then cognitive levels of well-being refer to things related to like your evaluation of your life. So another way to think about it is essentially kind of the thoughts and feelings that are associated with well-being. And well-being can be conceptualized in terms of different temporal components. So there are more enduring aspects of well-being, And those are things that, don't fluctuate that much. They don't show that much change and variability, even when they're assessed repeatedly. So an example of that would be something like depression. So if you're interested, or when researchers are interested in studying depression, you don't have to necessarily ask about whether a person is feeling symptoms of depression multiple times to get a sense of whether that person is feeling depressed. These are typically things that are a little bit more enduring, and so they're asked less frequently. So this would be an example of sometimes this is measured every 2 weeks or so. So we might say during the past 14 days, how often did you feel the following symptoms? So that's an example of a more enduring aspect. There's also more short-term aspects of subjective well-being. And then those are things that are typically, also related to cognition and affect, but that are more variable and that change more over time. So these would be things like stress, anxiety, like mood states, essentially. So things that are really susceptible to kind of the current situation that a person is in, what they're experiencing, and the kind of in their day-to-day life. And you could imagine asking somebody how stressed they are several times a day and getting slightly different answers. So the way that we think about subjective well-being is that there are kind of, there's cognitive and affective levels, but there's also enduring and more short-term aspects of it. And this will be important, as you'll see when we get to the methodology, because we do measure these two different components of well-being in this work. We look at both enduring and also short-term. Okay, so that's just kind of the orientation to how we're considering well-being, or how we're operationalizing well-being here. And then human mobility, as this audience of course knows, is a kind of a broad term, but generally refers to the ways in which people interact with and move about their physical environment. So most of the past work on mobility behavior, I should say more from from a social science perspective, at least, has focused on population level patterns. So things like air travel, commuting, migration patterns, and obviously, GPS data has been used, and other forms of movement and mobility data have been used to understand these kind of broad population level patterns. However, less is known about individual mobility behavior. So there are fewer studies that focus on what we know about one person and how they move about their physical environment as they go about their day. So what we were interested in was focusing in on this individual mobility behavior level and then linking that to people's psychological experiences. So the GPS sensor, if we think about how GPS data might allow us to assess movement patterns at this individual level, it provides, we conceptualize this, and after having reviewed the literature, as kind of providing 4 broad indices of information. So one is that the GPS data allows us to capture information about the spatial range of movement. So how, let's say how far a person travels in a given day or in a given region or over some span of time. The second component would be the frequency of movement that a person exhibits. So, if you look at an individual person's GPS data for a day, you might see that they change the places that they spend time in quite frequently, whereas somebody else might, just stay at home all day, and so they would only have one observation in terms of how many times they moved that day, in terms of different places visited. The third example here would be the degree to which a person's movement is regular or irregular, or conforms to a certain routine. And then the degree to which movement is evenly distributed across time and space. So this refers to, how much time a person spends in different places and whether that time is evenly distributed or if it's, very imbalanced, and somebody might just spend a lot of time in one place and less time in another place. And so these different approaches to, using GPS data to infer this kind of information about movement patterns has already been linked to different well-being and mental health indices. So here on the slide, you can just see this is a list of different constructs that have been studied in the well-being and mental health space. this is not across social science, this is across several, also a lot of computer science, but also some work that is kind of at the intersection of computer science, data science, and clinical health or clinical psychology. So for example, you have work that looks at depression, loneliness, anxiety, affect and mood, happiness, stress, and energy. And then all of these papers that are listed here are just examples of papers that have essentially used sensing data and GPS smartphone sensing typically methods to collect GPS data, and then have linked GPS data to these well-being constructs and shown that there are some associations between individual movement patterns, like those that we just saw on the previous slide, and then people's self-reports of these different well-being experiences. But one thing that is worth noting that, kind of was one of the motivators for the study and the work that we were presenting today is that most of the past work that is listed here on the slide as well had focused on a narrow set of mobility behaviors. So they might have only really focused on distance or only really focused on locations visited and or isolated indicators of well-being. So many of the, of the past work in this space that was looking at mobility behavior and well-being, some of the studies really were just focusing on one component, like a whole study on stress and movement patterns, as opposed to kind of taking a broad, comprehensive look at all these different well-being markers within a same sample of people, and how a broad swath of movement behaviors might also be related to those markers. So that was one of the motivations for this work. And just to give you a more concrete example of the kinds of findings in this literature, I'll highlight depression because there's been a lot of the work on depression has actually focused on looking at how mobility is related to it, because depressive symptoms can also affect daily life in terms of having the energy or the motivation to really leave the house or go to work or engage in physical exercise. So a lot of the, from a theoretical perspective, it is relevant to think about, how we might be able to infer depression from GPS or accelerometer data, because that could be a clinical indicator essentially of someone struggling with depression. So here on the slide, I'm not going to read all of these, but you can just see this is an example of essentially these are all different findings that have been associated with depression in the past literature in this area. So some examples are, and these are from using GPS data. These inferences are based on using GPS data. So examples are that participants in research studies who were reported experiencing depressive symptoms also tended to show longer duration of staying at home in their GPS data. They would have smaller numbers of location clusters that were visited during some span of time during the study. They traveled lower or less amount of distance than people who were not depressed, and so on. And so, one of the motivations and things that was driving this work was that we really wanted to take a kind of a comprehensive look at how not only depression, but all these other well-being indicators might be linked to these various GPS-based movement indices. So that brings us to the study aims. So as I mentioned, we really wanted to kind of look at this simultaneously. So, to essentially collect a large scale data set that would allow us to look at multiple indicators of movement and mobility behavior from GPS data and assess those simultaneously, and then identify whether, all of these individual, movement pattern features could be reduced and are somehow reflecting a latent behavioral dimension that could then be used to characterize individuals based on their mobility patterns. So as I had shown on the previous slides, many of those studies have focused on subsets of movement features from GPS data, and we were interested in seeing, how those movement features are all related to each other, and whether there's a kind of a simpler way of characterizing the many ways of processing GPS data to come up with latent behavioral dimensions that we could use to then characterize mobility behavior over time. So that was our first study aim. And then the second one was investigating the relationship between mobility behavior and those multiple indicators of subjective well-being. So not just focusing on depression, but also looking at loneliness. And here we looked at the short-term aspects of well-being, affect, stress, anxiety, and energy. So our research questions that I'm presenting here. So the paper has additional analyses and additional components to these research questions, but what I'm focusing on here for this talk is essentially this first question being about the underlying behavioral dimensions. So which of these could be used to characterize patterns in individual movement? The second is, how do people's mobility behavior tendencies relate to their subjective depression and loneliness tendencies? And then the third is how people's mobility behavior at the daily level relate to their daily affect, stress, anxiety, and energy. And so the main thing to note here between question 2 and 3 is that the second question has to do with the more enduring aspects of well-being, so depression and loneliness. And then it also has a parallel where we're focusing on general trends in mobility behavior, which we're calling mobility behavior tendencies, over a 2-week period of time. So we looked at mobility behavior over 2 weeks and looked at how that was related to depression and loneliness, because those are more enduring aspects of well-being. And then for the third question, we focus at the daily level, and we're looking at how daily mobility behavior relates to daily affect, stress, anxiety, and energy. So those are just 2 different temporal levels of analysis. Okay, so how did we do this? So first, we had essentially, so our participants, I'll talk about the participants and the sample first, and then go into the procedure and the GPS, information about the GPS data. So here we had 778 students who participated, who were enrolled in a psychology online course at the University of Texas at Austin, where I did my PhD and postdoc work. They participated for an average of 7 days. So this was an online psychology course that enrolls more students than this. It's usually over about 1,000 students per semester. And I'll explain in a moment how they participated in this research. So the average, so since this is a college student sample, the average age was about 19 years old. And then there was a standard deviation of about 2 years, so young adults. And then about 60% were female. So since it was a psychology online course, as part of the general course activities, students could complete survey measures as they learned about different psychological constructs. So they would learn about, depression and loneliness and well-being indicators. And then they had the option of completing standardized surveys about these constructs to get personalized feedback. And participation was voluntary for this and for the actual use of the mobile app, the sensing app. So it is a bit of a convenience sample in the sense that people self-select, to participate. But we were encouraged by the very high sample size. So for sensing studies, especially in the social sciences, this is we were happy that this was a large sample size and people were interested in actually volunteering to complete the study. So the survey's data was collected that way. It was voluntary completion in exchange for personalized feedback. And then the sensing data was collected as part of a course assignment in which students learned about different novel methodologies that are being used in psychology to understand human behavior. And they were able to complete this assignment where they were supposed to monitor their own behaviors and then reflect on their lifestyles and college experiences. And they could use one of 3 modalities. So they had the option to pick between a mobile app, which was the focus of the current study, and that's the data that I'll be reporting on today. They could also choose to complete the assignment using emailed surveys or a handwritten journal if they didn't want to collect any data and didn't want to participate in the research at all. So here, the 778 students are those who elected to use the mobile app, and there was a subset who used the emails, and then another subset who used the handwritten journals. Although overall, the main incentive for using the app and the email as well was to receive personalized feedback. So anyone who wanted to get visualizations of their data, of their GPS data, or their self-reports, used either the emailed surveys or the mobile app. Okay, so here on the slide, you just have a list of the, I guess this should maybe say measures instead of procedure, but here you have a list of the measures. They have the depression and loneliness were completed. They were one-time measures. The Center for the CESD scale is what we call it. It's a 10-item measure asking about different depressive symptoms, and people indicate over the past 2 weeks the extent to which they felt the various symptoms. Loneliness asks people about their sense of social connection, and how much they feel connected and interacting connected to others. Then those are the 2 one-time surveys that I'll focus on. And then we also had these repeated surveys that were delivered 4 times a day through the mobile app. And those were asking about anxiety, affect, stress, and energy level. And here you just have the actual wording, so you can get a sense of what they were asked. They would get a notification to their phone that asked during the past 15 minutes, how anxious and easily upset were you? And they rated that on a scale from not at all to 5 very much. For the affect, stress, and energy, they would say, right now I am feeling, and then they would rate how they were feeling. And on average, participants, those 700 participants completed about 22 surveys each on average, but some completed more or less with a standard deviation of about 10 reports. And then we also collected passive sense. So the passive sensing data collection also included GPS. It also included other types of sensing data that I won't focus on here, but if you're interested, I'm always happy to talk about it. You can just reach out. So here, the GPS data we collected from the app, I'll go into more detail about this. So we had time-stamped latitude and longitude and latitude coordinates, and those were supposed to be collected every 10 minutes. That was the specification that was programmed into the actual mobile app software. So if everything was working smoothly with the app on the person's phone, we would be collecting latitude and longitude every 10 minutes. When we process the data, of course, we do notice that there are some inconsistencies where sometimes somebody's mobile app would be closed out or not collect the data. And so we try to clean that up in the processing steps later after the data have been collected. But the design was 10 minutes, every 10 minutes. And we picked 10 minutes in part to get both like a fine-grained portrait of where people spent their time and how they were navigating their environment, but also because in tests, we found that if we went higher in frequency than 10 minutes, people's batteries would drain. So then we had the number of GPS observations. So overall, the total number of GPS observations was about 550,000 records, and we removed outliers to try to remove any cases where participants, for example, had like traveled or flew during the time of the study. So if they had like traveled outside of the state, this was conducted in Austin, Texas. So if they had traveled very far, like took a plane somewhere and then all of a sudden had a very high distance traveled, for a day, those outliers were removed so that we were focusing on people who had generally stayed within the Austin and Texas range, I would say. And then for the 2 weeks of the study. And then we extracted mobility features at 2 levels of analysis. One is at those 2-week periods over the duration of the study, and then at the daily level. And here on the bottom, you can just see this is a screenshot of what the data look like, and then a list of mobility metrics. So you can get a sense. We have like randomized user IDs, latitude, longitude coordinates, and then we try to infer or process the data to get at these different mobility metrics. And we extracted 23 mobility features. I'm not going to read through all these. I'm just pasting them here so that you can kind of get a sense of how we did this. So we looked at the categories, and essentially the way that we derived our list of 23 features was that we looked at the past work in this area that had used GPS data to infer movement patterns. And we compiled a list of all of the features that we could find and that we could, recreate and compute on our side. So we had, first was a broad category of distance features. And these were things that directly, that it reflected the distance between GPS coordinates that were visited by a person. And so 2 examples are the distance covered in a day or over 2 weeks, and then the maximum distance from home. So we would take the maximum distance from home in a day and over 2 weeks. And then here, this is just a screenshot of a table that provides like all of the information about the different features that we computed. So this is pulled from the paper. But these are just the lists of different features that we found in the past work. Here's the references to the papers that we used to derive the formulas essentially to process the data and extract those features. And then this is a description of the distance feature, each of them. And then this is the time frame. So if it has a D, it indicates that we extracted this at the daily level. If it has a T, it was at the aggregate level across the entire time frame as well, across the 2 weeks. And then if it has an X, that indicates that the feature was log transformed for analyses to get them all onto the same scale prior to our data analysis. So we had to do that for any of the variables that were like very highly skewed, which many of them were. And then a second category of these, we have 4 different categories. So I'll go through these more quickly now that you're oriented to the slide. We had a set of entropy features, which has been used as a measure of place sequence variability. So we primarily in this work focus on the distribution of time that people spent over different locations. So we would use the location clustering to determine these various entropy features to see how much time people spend, the duration of time they spent across locations. Third, we had irregularity features. And so these were trying to capture the degree of routine versus irregular patterns in their movement patterns. And one of these could not be computed. I'll just highlight that one at the daily level because it required a sequence of 24-hour days to be able to, infer the circadian movement over time, which is a regularity in a 24-hour rhythm. So here we that's the one that we did not compute at the daily level. And then fourth was location features. And so here we have the number and kinds of locations that people visit during the day, including just the number of location changes and the number of location clusters. So I should note that we did not focus on the semantic label for the locations. That is something that we've done in other work, but here we were not, we were trying to really capture movement patterns and how people spent time in different locations, but we weren't actually analyzing the label of the type of location except for the home. And we operationalized home as the location where a user spent most of their time between the hours of 2 a.m. and 6 a.m. So we would look at the GPS data and try to infer the person's home location based on where they spent time at the middle of the night, essentially from 2 to 6 a.m. But of course, depending on your research question, that could be set differently. So, okay, so now we'll transition to the results and we'll start with the first question. So just to remind you, where the first question was what underlying behavioral dimensions might characterize all of the kind of the variance in these many mobility features. So our strategy here for this research question was to conduct exploratory factor analyses of the 23 GPS-based features, which if you're not familiar with factor analyses, it's a dimension reduction technique. So it's just pretty standard in psychology and in social sciences when trying to kind of reduce many variables and come up with kind of a broader picture of what are the latent dimensions that characterize the variance in a set of observations. So here, our solution, our factor analysis resulted in the 73% of the variance in our observations being explained by our 3-factor structure. And I've also just pointed out here that we also did this at the daily level, and it explains 61% of the variance. But in this talk, I'm just focusing on the 2-week for the second question, and then the daily level for the third question. The paper has the full set of analyses and results, though. And then the main thing I want to highlight about this before we just dive into the visualization of these is that all of our factor analyses at the 2-week level and at the daily level indicated that a 3-factor structure fit the data well and explained much of the variance. And those those different dimensions essentially were mapping onto the ones that we identified just conceptually from the literature, which was distance, a set of a kind of a behavioral dimension of distance that is being represented, entropy, and then irregularity. And the location features did not load onto their own factor. They actually got distributed across the entropy and irregularity dimension. So here, I'm just showing you a visualization of what these look like. And on the left-hand side of the screen, you can see these are the factor loadings. So this indicates which of the specific mobility features or movement features loaded highest on this factor, and which were loading lowest. And so this first factor was a kind of a behavioral dimension of distance. And on the right-hand side of the screen, you could just see a visualization of two participants who were selected for illustrative purposes to kind of show you what a person who is high and a person who is low in distance looks like in our data. And so what we did was essentially we ran these factor analyses, and then we saved the factor scores and associate that with each individual. So each participant in the sample would get a score from low that ranges from low to high, because it's a dimension of essentially distance. And they would they would essentially have a score from low to high. And here on the slide, you can see participant A, which is this one, had an example of a low distance score, and a participant over the span of the study. And a participant B over here had a very high distance score over the span of the study. And for this plot, for this visualization, all available GPS points recorded during the study were mapped onto like a real map of Austin, Texas. And the zero point represents the center of all GPS coordinates for that participant. And what we did was we just removed the mapping beneath to preserve privacy, of course, and to just kind of show and focus on the visualization of what is this actually telling us about the person's movement pattern. So you can see that this participant A is somebody who is characterized over 2 weeks as being very low in terms of this distance behavior. And participant B shows a great high degree of distance as a behavioral pattern over 2 weeks. Yeah, okay. So I'll just show you the next ones. So this is just entropy, same thing. I won't go into this one in as much detail, but you get the idea here. The loadings, just showing you which of the specific features loaded onto entropy. And this is a participant who scored low in entropy, and this is a participant who scored high in entropy over the 2 weeks of the study. And then for irregularity here, you can see this one is actually showing you, this is participant A is two of these plots here on the left, and then participant scoring high is participant E. And essentially irregularity now is looking across 2 days of 2 continuous days to show how similar they are. And in this case, the 0 point represents the home of the participant. And so this participant, you can see who scores high on irregularity from day 1 to day 2 had a very different pattern in terms of where they moved in their environment and how they moved around their environment. Whereas this person who scored low had a much more routine kind of pattern in terms of how they moved around their environment. So, okay, so why do we do this? We wanted to use these behavioral dimensions and these factor scores as essentially an individual difference measure and look at how those relate to people's subjective reports of how they're feeling. So in the next, to answer research question 2, we looked at the factor scores for those 2-week tendencies for distance, entropy, and irregularity. So now we have one kind of score per person, and we've created this behavioral score of how much you travel distance-wise, how your movement is characterized by entropy, and how irregular it is. And then we correlated that, just simple Pearson correlations, with the self-report scores on depression and loneliness. And what we see here is that we didn't observe any associations between distance and entropy and these measures, but we did see that loneliness and depression were associated with irregularity in people's movement patterns over 2 weeks. So what this suggests is that the people who tended to have more irregular movement as opposed to routine, so more irregular movement, was associated with less self-reported depression and loneliness during the 2 week span. So less irregular patterns over 2 weeks was associated with also having reported less depression and less loneliness. Although the effect sizes are obviously not that high, but very standard for kind of social and personality research. So those small negative correlations there between those constructs. Then the third question then, and then we'll wrap up, is how people's daily levels, so that was the kind of 2 week pattern, so irregularity and depression and loneliness being associated at the 2 week level, and then now it's transitioning to the daily level. And so here, because our observations are nested within individuals, we had 14 days of observation, so we had 14 factor scores per person, along with anxiety, affect, stress, and energy. So what we wanted to do here was look at essentially, we ran a series of multi-level models where we have daily observations nested within individuals. And here the daily level movement factor scores were analyzed as predictors in separate multi-level models where anxiety, affect, stress, and energy were the dependent variables. So we're basically trying to predict daily level anxiety, daily level affect, daily level stress and energy from their daily level movement score. And then the movement factor scores are person mean centered. And the relevance of that is that we're basically comparing how much a person varies from their typical baseline or their typical average. So we're looking at how much a person, how far or how much distance a person traveled in comparison to their average tendency. And so here I've just highlighted the main findings from these many series of analyses. But for distance, we found that on days when people traveled further distances, they also reported less anxiety and less stress. And more positive affect. So these are on days when people travel farther distances compared to their average, they report less anxiety, stress, and more positive affect. On days when people show higher entropy, so when they spend their time more evenly distributed across locations, they also reported less stress. And then on days when people show higher levels of irregularity in their routine, they also reported less energy. So, and that is, on days when people show higher levels of irregularity compared to their average, they're also on those days saying that they feel and have less energy than high energy. So just to kind of summarize and give you the big picture here, we found that GPS features, when we looked at all these different GPS-based movement features that have been used in the literature to date, we found that they map onto these 3 latent behavioral dimensions: distance, entropy, and irregularity, and that location features kind of really were getting included in the entropy and irregularity dimension. And that at the tendency level, people who tend to have more irregular movement patterns over a 2 week period of time also tended to report being less depressed and lonely, and that people who tend to report greater subjective well-being, that people tend to report greater subjective well-being on days when they travel farther distances, have higher entropy, and have more regular patterns than usual compared to their usual daily tendency. So that's a summary of the results. And then I'll just conclude with some implications and next steps. And I believe I'll note some challenges for us as social scientists. So generally, this work contributes to a broader literature in psychology, but other social sciences as well, on the benefits of physical movement and how that relates to subjective well-being. One of the most immediate next steps for us in our work is that we really, of course, these are correlational findings. This was a longitudinal study where we, observed mobility behavior, and then also ask people how they were feeling, and then are looking at the associations between these variables. But we cannot make causal claims, of course. So one of the next things that we're interested in doing is actually running field experiments to test the causal direction of the observed relationships. So for example, asking people to spend time traveling farther distance than they might otherwise in a typical day, and seeing if that actually might lead to changes in their subjective well-being. One of the implications of this work, and more broadly, the work that uses GPS data in the social sciences to understand psychological well-being, is the idea of being able to develop better diagnostic tools for a range of mental illnesses, or as a way to kind of help people understand and attain self-insight about the behavioral changes that they might make to improve their well-being. But one of the challenges that's limiting this kind of application is the lack of consistency in findings across studies regarding feasibility of doing this and actually creating, diagnostic tools, but also the generalizability of findings linking mobility behavior to well-being. So Sandrine Mueller and Sandra Matz, who are two of my co-authors on this work, they recently just published a paper where they were trying to look at replicating a lot of the associations that have been found between the GPS data, between GPS-based movement features and the prediction of depression. And because that has been kind of one of the major focuses of work in this area. And they actually found that when, you use a really large sample that is in an urban environment and in different places around the world, that these findings don't necessarily hold. And that it's actually hard to replicate some of the findings that have been shown in the past. And that one of the possible reasons is that, your physical environment, of course, also shapes the way that you would engage with it. If you live in New York City or if you live in a rural town, there are different ways that people are just structurally engaging with their environment, and that won't necessarily, so these findings won't always necessarily generalize depending on where the person is, and other sociodemographic characteristics, of course. So that's one of the limitations of the moment, or kind of challenges that's spurring future work. And then more broadly, we're hoping that this kind of work encourages an awareness of the psychologically meaningful inferences that can be made based on GPS data, because as I'm sure you are all aware, many of the apps that we use on a day-to-day basis, even if they're like a gaming app, will ask to collect location data. And I think it's not very clear, it's becoming more clear, I guess, in the social science literature, but certainly it should become more clear to the public, essentially, how our GPS data can still be used to infer psychologically meaningful information about us, and that we might not want to share it with just anyone who requests it, as is kind of a default in terms of how the current app landscape is constructed. So we're hoping that this also is highlighting kind of this source of information. And then finally, some challenges and direction. So there are practical, analytical, and ethical challenges, of course, with using GPS data to study human behavior. Some of the practical and analytic challenges might not be challenges that your community faces, but I think as social scientists who are interested in using these technologies to understand human behavior and be able to reliably and accurately assess movement patterns. There are many practical challenges that have to do with kind of the interdisciplinarity of the work, the technical expertise that's needed, the modeling strategies, decisions about data processing and data cleaning. And so in this paper, I mentioned Wei-Chen Wang was our computer science collaborator on it, and he handled a lot of the data processing and feature extraction. It was actually a very rewarding experience because we were able to kind of bring in the theory, and he was able to bring in the technical expertise to answer a question at the intersection of both psych and CS. But there are certainly challenges to doing this kind of work. And then, of course, there's ethical challenges related to data security, privacy concerns, and also transparency about the data that are being collected, and allowing participants in research studies, of course, to opt in to data collection. And so, in the academic landscape, we have review boards who review and ensure that we're meeting ethical concerns regarding how data are collected and handled. But more broadly, I think the way that GPS data is handled is not, of course, as regulated. And so there are interesting ethical quandaries to address when it comes to using GPS data to understand human behavior and psychology. And I'll just conclude with a shout out also to two of my colleagues and I, so Saeed Abdullah and Edison Tomaz. So Saeed is a professor in information sciences with background in CS, and Edison is in electrical engineering at UT Austin. We have a consortium that we've put together. It's an interdisciplinary intellectual community, and we essentially are. It's a broader network of over maybe 24 or so researchers in social science and computer science and engineering who are interested in collaborating on this kind of interdisciplinary work. So we try to get people together based on their research interests and the kind of data that they're interested in or have already access to and might be open to collaborating and working with others on. And we seek funding and support open science practices in this research area. So if this kind of work is of interest to you, I'm plugging it here because we're always looking for interesting conversations, but also collaborators or possible ways of working together. So with that, I will stop and thank you for your time and attention, and take any questions that you may have. And here I've just thanked my co-authors again, and then my co-PIs on an NSF grant that supported this work, Sam Gosling at UT Austin and Andrew Campbell at Dartmouth College. And then of course my lab. Thanks.
Thank you so much, Dr. Harari. We appreciate this really interesting presentation. If you have a question you'd like to ask Dr. Harari, please click on the Q&A button in your viewer. She'll be happy to answer any questions you may have. We do have a question from Sean, who asks, did you try to infer the mode of transportation? For example, if someone's taking a car, a bus, or a bike for travel, and if so, were there any correlations to reported energy level, et cetera?
Yeah, thank you, Sean, for the question. In this set of findings in this paper, we didn't do that. So the short answer is not in this paper and in this set of findings, but generally with this type of methodology and with other work that we've done with this data set, we have done that. And the way that we've typically done that is through a combination of like looking at the GPS and also the accelerometer data. I think most of the time we're focused on bicycling and trying to determine whether somebody is in a vehicle or bicycling or walking or stationary. I think we have one running classifier that sometimes we use, but many people in our samples don't often run. So typically we're looking at stationary, walking, and then biking and vehicle driving. And that's in combination with accelerometer typically. But in this work, it was just using the GPS data. And so we didn't do that.
Okay, great. Yeah, I could see how that could certainly affect it. Like you say, if someone's running or biking versus traveling elsewhere, that could have an impact. So very interesting.
Yeah.
We have another question from Xiao, who who asks, would this type of GPS movement and data collection be impacted by work from home, the trend that happened during COVID? And what might be your recommendations for accommodating or for considering this change in your data?
Yeah, thank you for the question. Yeah, so the data set that we reported on here was collected in 2016, 2017, I think. And so, but you're 100% spot on that the pandemic has very much influenced our mobility data, the kinds of inferences that we can make about mobility. And we've run studies during the pandemic to actually understand the degree to which people have changed their movement patterns as a result of various like stay-at-home orders throughout the pandemic period and how those vary by region. And we do find that many people who were able to work remotely and stay at home, their range of movement was obviously very restricted. And so one way that we've tried to get around this to be able to kind of account for that in the data is that we ask people what they're doing in those surveys. We ping people a few times a day, typically 4 to 6 times a day. we'll ask them, what were you doing? Where are you at home? Are you at work? And we'll just kind of get a sense more broadly, also from survey data, about whether they work from home, to get a sense of like how to interpret that. Like if somebody is at home the entire day, how we would make an inference about that. But most of our work during the pandemic period is actually about how the pandemic might have influenced people's in exploration of their environment and their kind of mobility patterns. So definitely has affected the GPS-based inferences.
Yeah, very interesting. Thank you. And actually, this next question, I think, ties into what you were just explaining, which said, this is another idea which might be far-fetched, but would you expect the physical movement mechanism you studied here to replicate through digital space? For example, moving from one app to another app. And that might go to what you were saying during the pandemic. What were you doing at this time versus that time? Maybe they're in the same physical space, but perhaps they're doing something different. And does that translate? And is that a study that could, is there data there that could be studied in a similar way?
Yeah. That's a very interesting idea and question. And it actually is very similar to some conversations we had here in the Department of Communication a couple of weeks ago with myself and Byron Reeves and Nilam Ram, who, if you're interested in like digital media behavior, they have a lot of really interesting novel methodologies to try to understand this. But yes, what we've done, so like one example of something we've done is tried to look at the combination of GPS data with app usage logs to get a sense of essentially like how people use digital media on their phones. So what kinds of apps people use in different physical places. But we haven't yet really tried to figure out like how to think about how people move around in their digital space. Although it's something we've like thought about as an idea, but haven't like sat down and tried to figure out how to do it practically. But if you have ideas, I would love to hear them. Because we essentially have like app usage logs, which are just event logs that indicate when a person uses a given app and the kind of name of that app and how long they use it. But we haven't actually tried to map it the way that we do with the movement data.
Okay, great. Thank you. Now, you mentioned these data may not apply uniformly to individuals in various regions of the world or different geographic areas. Are there plans or discussions to perform similar studies elsewhere? And was there any changes that would be made to how the data is collected?
Yes. So we currently right now have a collaboration going with a few colleagues in Germany for, so Micha Bach is the main PI he's in the Department of Psychology at the University of Münster. And he's the main PI. We just received a grant through one of the German science foundations to run a study that is actually an international study. So the main PI is based in Germany, but we're the US collaborators, myself, Sam Gosling, who was on my acknowledgement slide, and Sandra Matz, who was my co-author on this paper. And this is a study, it's an international study about how people are responding and coping with the coronavirus crisis and or coronavirus pandemic. I guess it's a crisis depending on who you ask and where we are in the pandemic. But we're interested in how it's affected people psychologically in terms of their stress level, their energy, and so on, but also how it's affected their everyday behaviors, like their physical movement and mobility. And that study, we just launched data collection in January, but it is an international study. We're aiming to get, I know it's about 500 participants, and currently we have about 20 to 25 countries around the world participating. And that's an experience sampling study right now. So right now it's just those survey questions several times a day, but we're rolling out a mobile sensing component in the coming year or two. And so that's all in planning right now. And we're trying to figure out the different like ethical and regulatory challenges that come with collecting data in other countries, but we're working with academics at those individual countries to run those studies.
Yeah, fascinating. Lots to consider as you scale outward, for sure. Yeah. I think we have time for one more question. So this is another question from Sean, who asks if you noticed any systematic difference in data quality or GPS quality, like accuracy and availability, from different makes or models of phones, like the operating system, Android versus iOS, or a Galaxy versus an iPhone, or even models of phones. I don't know if that was included in your data, but that's a question from Sean for you.
Yeah, thank you, Sean. Yeah, we definitely, so we do notice differences. One of the main reasons I think that we notice the difference is because whenever we run one of these studies, the sensing app software itself, it has like a bare minimum compatibility, in terms of like the type of the version number of the software for Android or for iOS. That should be on the phone, the Android or the iPhone. We typically use Android or Apple phones. And so what we do is in our participant like onboarding, when we like introduce people to the study and ask them questions that will determine whether they're eligible to participate, we ask them what kind of phone they're using and what the software version is that they're running on their device at the time of participation. And then we will look at that and try to filter out. Sometimes we have to remove participant data completely because they're using a phone that is like just not compatible with the software that we're currently using. But there is differences based on software. And I haven't noticed personally based on Android versus iOS, but definitely based on software is something that we always look at in data processing.
Well, great. Thank you again for this really interesting and informative presentation. And again, if you have any questions for Dr. Harari, I noticed you had your email address up a little while ago, so that will be on the recorded webinar. We will have the slides and recording posted to our website later today, so please feel free to check it out later. Again, Dr. Harari, thank you so much, and enjoy the rest of your day.
Thank you. Thank you so much for having me. Thank you all for attending and for your attention. And yes, if you have any questions or just think this is interesting and would like to talk, we're always interested to chat more. So you can just email me.
Wonderful. Thanks again.
Thanks.
Take care.
Thank you. Bye.